Okay, so we'd like to transition over to sort of this panel discussion. So if I could ask those people who spoke in the first session, as well as our two additional panelists, to come up and take a seat at the table. I will briefly introduce the two additional people now, give them a little bit of time to also introduce themselves to you. But we have two additional members of the panel, and the first is Pune Saberi, who works as an occupational and environmental medicine physician in Philadelphia. She has faculty appointments at the University of Pennsylvania, the Cooper Medical School in New Hampshire. She is responsible for planning and delivering population-based employee and environmental health services to her patient population in these various clinics. She teaches occupational and environmental medicine residents in the residency program, as well as developed and teach a climate and health course at Cooper Medical School in New Jersey, which addresses community adaptation and mitigation, as well as resilience within the healthcare system. She has a medical degree and Master of Public Health from Tufts University in Boston, and has served as the past president for Physicians for Social Responsibility at the national level, and continues as a board member on the Pennsylvania chapter. Our second addition to the panel will be Allison Steele, who earned her undergraduate degree from Drew University in Madison, New Jersey, and her MBA in Sustainable Business Practices from Duquesne, again, another Duquesne alum. As part of her graduate work, Allison studied sustainability tools and practices used by leading companies in Europe, and worked as a consultant for large Pittsburgh area companies as well. She worked for a number of organizations before she joined the Southwest Pennsylvania Environmental Health Project, of which she is now the executive director. Basically, she describes her work as, quote, taking advantage of our increasingly virtual world to extend their reach as they work to defend public health in the face of oil and gas development. So I'll just quickly ask Pune to come up and give some comments, and then Allison.
Thank you so much. And good morning, everyone. As said, I'm Pune Saberi, and I appreciate the opportunity to come here today to share some of my thoughts with you. I know more than 110 people online, and as a physician, I'm here to really speak to the perspective of the clinician and the healthcare provider, as well as those who go to their healthcare providers concerned about environmental exposures, and really to kind of bridge the gap between a lot of what we've heard so far and what we'll hear for the rest of the day into what happens in clinical practice. I'd love to know of the folks who are online and of the folks who are in the audience, how many of you are practicing healthcare providers? If you can raise your hand so that I can know. Great, thank you, thank you, thank you. Okay, so I'm an occupational and environmental medicine physician, and I want to talk about the historical work of the last 15 years. The kind of the onset of shale gas activities in Pennsylvania before that, but really my involvement started in 2010. And at that time, I was witness to Pennsylvania community residents expressing concern about their health and their proximity to shale gas operations, and we'll hear this theme a lot. They went to their doctors, other healthcare providers. They were frustrated because they were maybe dismissed. The provider maybe lacked the knowledge to address their issues. And then ultimately, there was a lack of solutions. On the other hand, these providers were bewildered, and really, at that time, no research to guide clinical decision-making. And, I know there's people in the audience here today who can attest to, how little research existed at that time. What we're hearing today. Here, and there's been an outpouring of, studies, and many of them do have clinical implications. And yet, just last month, PSRPA hosted a webinar that was titled, How the Environment Threatens Your Health and How to Talk to Your Doctor About It. That webinar was prompted by conversations with residents who were expressing the same concerns 15 years ago. They were, they were, in relation to exposure to shale gas operations. They were residents and workers who would go and they would, try to talk about these exposure concerns, but didn't have satisfactory answers. And so it's been the same despite, all of this research. So how does the gap between research findings translate into clinical practice? How do we fill that gap? In my opinion, that really should be spearheaded by medical and public health institutions like Pennsylvania Department of Health and at that time was not always really leading the effort, but in the past few years, they've made progress on disseminating information. And last month, there was an ECHO webinar, then that's a good example of this because, they outlined a lot of the health issues. I don't know if I can say the same for other, county medical societies, because as far as I know, there hasn't been a lot of endeavors in really trying to translate research into clinical practice. In the absence of those organizations, other organizations like PSRPA and like EHP, Environmental Health Project, with Allison that you'll hear from, they've been educating and answering questions. So I'll use the next few minutes to highlight how the findings from studies like the Pittsburgh study that came out, I think it's a year and a half ago now maybe, can be clinically relevant. And I will add that the weight of the evidence from these studies is at least are less research. So number one, I'm going to talk about respiratory health. That's intuitive. Oil and gas operations produce enormous air pollutants, and air pollution exposure has repercussions for ear, nose, and throat, as well as the respiratory tract. These studies found that asthma attacks and hospitalizations increased during the production phase of wells for those living within 10 miles. So how can clinicians incorporate this into practice? Most people who live near these industries know the name of the well and exactly, like how far there are from it. So the clinicians should document that in their record and implement a health diary that tracks the symptoms like shortness of breath, nighttime cough, and initiate a robust treatment regimen that prevents aggravation and hospitalization. Number two, cardiovascular health. The connection between air pollution and cardiovascular health is not immediately obvious, but the literature heart attacks increased, heart failure increased, as did hospitalizations for them. So the clinician should consider, again, the location, the zip code, proximity to calculation of the risk of heart disease, in addition to all those other established risk factors that we hear a lot about, like smoking and diabetes, et cetera, and have a higher index of suspicion for obtaining things like echocardiograms and stress tests when their patients have risk factors live within proximity of these operations. Number three, pediatric cancers. Living within 1 mile of a well increase the risk of lymphoma in children. So the primary care provider, again, should document that proximity and then monitor recurring infections. A lot of babies present with, like, let's say, recurrent ear infections that they don't respond to antibiotics. And so check complete blood counts for things like lymphocytes. Number four, perinatal health. I loved the term. A lot of studies have shown that low birth weight, being small for gestational age, prematurity occur in babies born to families living within 10 miles from wells. And this where I think is where Department of Health can really do educational campaigns for women who are planning to become pregnant, who are already pregnant, and institute services to check on them. transportation, take them to appointments, review signs and symptoms of preterm labor with them. Number 5, there are other general considerations like depression and that we heard about, and then these other population-based measures that should be considered, like screening for communicable diseases. Lastly, as an occupational and environmental medicine physician, I would be remiss if I did not mention workplace hazards. The extractive industries have the 3rd highest fatality rates than any other industry, and they have very high motor vehicle accident rates. They have occupational noise exposure and therefore result in hearing loss. They have suicide rates, silica exposure, and in general, self-reports of poor health. So the providers who take care of workers, occupational medicine doctors, they need to take into consideration audiograms, screening for faculties that ensure safe driving, like a good neurological exam, mental health screenings, and access to good rest equipment. In summary, the research landscape has changed a lot since 2010 when you can count on one hand the number of studies in relation to fracking at that time. But the application to medical practice has been really lagging, and organizations are doing a great job in addressing the concerns of patients and workers, but the established institutions really need to do more. I'll end by iterating what is glaringly and disappointingly unchanged despite the change in the political party in power, and that is the fact that there's been no change in the political landscape and the measures that have been put in place to protect residents and workers. Thank you so much. I will turn it over to my
Good morning, everyone. Thank you for having me here. The Environmental Health Project has been a long supporter of this conference in a variety of ways, and I am thrilled and honored to be a part of the Health and Research panel this morning. For those who are not familiar with us, EHP was founded more than a decade ago after residents in frontline communities that were hosting shale gas infrastructure began experiencing strange symptoms: headaches, nosebleeds, dizziness, nausea, difficulty breathing, things that they couldn't explain. There was very little research on the subject of shale gas development at the time, so our team quickly assembled and stepped in to listen to their concerns, gather data about their symptoms, their air and water quality, so we could learn whether there was a connection and what people could do to better protect their health. Fast forward to today, we have scores of peer-reviewed research studies, hundreds more investigations painting a clear picture that shale gas development is harmful to human health. As more of that information has come to light over the years, thanks to research institutions and the academic community, we have shifted our work from answering the first question usually get, which is to the second question: what can I do about it? And to help answer that question, we put useful advocacy tools in the hands of residents and for their protection. We do that by taking place-based insights that we get through data collection and analysis around sites of concern, distilling the ever-growing body of knowledge from the scientific community, and marrying those two in order to effectively educate decision makers who are tasked with protecting the well-being of their constituents. Now, that communications piece is, unfortunately, simply providing facts tends not to be effective. I think most of the people in this room, myself included, wish that that were not the case. But we have incredibly powerful lobbies fighting to keep the oil and gas and plastics industries alive. And their narratives take plausible deniability and spin it into an aura of safety and environmental protection. And that's why it's critical to take these issues and make the consequences as concrete and relatable as possible for decision makers. The PIT studies Pune mentioned, demanded by residents, paid for by tax dollars, overseen by the Department of Health, conducted by researchers at Pitt, great work with damning evidence about cancer, asthma, and low birth weights, but we already had a wealth of information available about the health hazards associated with this industry. Certainly, did. And now that we have showing clear results, our governor hasn't even acknowledged their existence. And speaking of his administration, I will give some credit where it is due. Despite limited budget and staff, despite what is clearly the fourth gas-friendly administration in a row, we have seen some more action than ever before, streamlining their resident complaint process, sharing information about health impacts of shale gas development with medical professionals through their Project Echo series, developing education for schools and families about air quality, and they informed us that they are currently reviewing health literature that has been released since their last lit review in 2019. These actions are all among the things that they committed to at the release of the PIT studies. And for anyone who was at that event, you will remember how contentious the environment was. There was a room full of painful stories. Not long before that, we had representatives from the DOH do a fraction with Lois Bauer-Bjornson, who I believe is on the agenda later today. And at both of those events, I saw people reacting to things that they clearly were not familiar with. And I'll say that it is profoundly meaningful to put a face and a story on what otherwise might simply be statistics. Now, it should not be the responsibility of impacted residents to advocate for their own protections, period. But what we've seen from them over the years is that they're really good at it, because they need to be. It's their lives and their health on the line, and they understand their experiences better than anybody else. So the work that we're doing at EHP strives to elevate the stories of impacted residents to provide context to the data that we have, and to provide science who want to back their stories with relevant science. And I'm going to share just a little bit about that in the brief time that I have remaining. Some of our most recent efforts at EHP include air pollution dispersion mapping around sites of concern using weather data and topography paired with networks of air monitors measuring PM 2.5 and VOCs. With all of this information, we can understand how parcels of air arrived at the monitor and reconstruct that pathway to illustrate whether the pollution was plausibly emitted by a nearby facility, be it a well pad or compressor station or cracker plant. And so think about it this way. You're a local leader. A resident is talking to you about health symptoms that the family is experiencing. She then explains that exposure to a certain chemical causes that type of symptom. Furthermore, a nearby facility emits that type of chemical, and there is data to show how often chemical emissions. That is hard to ignore. It's really impactful when you start to look at the context of the issue. And yet, harm prevention. And it is our hope that efforts like these across frontline communities will serve to get better protections, to secure better protections for people who are being impacted. But we hope that easier access to information about pollution dynamics, plus effects of compounds emitted by these facilities, plus best practices for communication decision makers, plus the all-important lived experience of frontline residents will help to shift the perception about the ongoing dangers of shale gas development in a way that can no longer be overlooked or dismissed. And so that way we can start to stop these harms before they're experienced. This fight will continue to be a group effort, making use of scientific expertise, lived experience, and the ability to convey that message effectively to those in power. And On that front, I am honored to be a part of that broad conversation with all of you and on this specific conversation with this health panel as we move into Q&A. Thank you.
Okay, so thank you, Allison and Pune, for those remarks. So thank you all for submitting your questions. I'll start off by saying that I've got many questions here so far on index cards. I apologize if I don't get to them all. I've tried to triage them to some extent to make them meaningful, broad, et cetera, et cetera. I do also want to start with, I guess, reaching out to, is it Ryan, who might be collecting some of the questions that are coming in online. So maybe we could start with a few of those. Otherwise, I'm liable to forget that whole audience to begin with.
Yeah, hey everyone. We have a really great audience here online, over 115 people currently. And we have a question here from Jack for Eric. Says, it seemed some of the plugged wells emitted as much as or more as an H2S as the unplugged. How is that possible? It seemed some of the plugged wells emitted as much or more.
Yeah, thanks for that question. I think you can hear me. So the plugging just has to do with the one of the components that of the pathway for emissions. Even unplugged wells may not be emitters because if there's no reservoir of gas left underneath where there's a pathway for the emissions to reach the surface in the first place. But the plugging wells and there's varying degrees of plugging that we can experience. There's only been standards developed over the last 50 years, but many of these wells are 2 to 3 times older than that. So plugging can have varying degrees of effectiveness as well, and sometimes plugging can fail and they need to be replugged.
Thank you. And this might be a follow-up question too. If these were all conventional wells, were any fracked conventional wells? If so, was there any difference in emissions?
Yeah, I don't remember. I don't recall if we looked at that in much detail as part of the study. Yeah, we didn't. I don't think we distinguished much between the conventional and unconventional.
Okay, thank you. There's another question I think is a little bit more broad that comes from Regina in West Virginia, who asks, how do the studies presented this morning relate to those of us living in close proximity to natural gas compressor stations associated with gas wells? Our county in West Virginia has set up numerous purple air monitors, mainly because the EPA and West Virginia DEP will not set up air monitors in gas-producing parts of the county. These monitors are all we have. How does the scientific community view the use of citizen science efforts?
Is this one on? Can you hear me? Cool. Citizen science efforts are becoming more and more popular across the scientific community. Purple air monitors have pros and cons like any given air monitor, but they're reasonably well validated in certain scenarios, so they can be really helpful here. Much of what we talked about today was really focused on, well, of the 2 more oil and gas focused ones, very specific to the extraction sites themselves, as opposed to that broader oil and gas network of infrastructure. But there's definitely work going on, even if it's not out yet, considering these compressor stations.
Yeah. Oh, is this on? Can you hear me? I absolutely agree with that. We work almost primarily with communities doing purple air monitoring, and the breadth of information that we get, not just about pollution dynamics from different types of facilities, but also how people are how they're getting information, how they're interacting with the operators. It's all incredibly useful information and contributes to a much broader data set that members of the scientific community can then use to analyze. I will say there is some industry pushback on the concept of citizen science as not being legitimate, but that is absolutely not the case. There is a wealth of information that comes from what is very realistically a low-cost and highly scalable method of gathering data.
Okay, was there anything else from online, or should we go to questions here?
I think there's one more that touches on a different topic. The question from John asks, why are Pennsylvania physicians often reluctant to comment on fracking-related symptoms that they see in their patients?
That also has a very long history. Again, back in like 2010s, in New York, physicians were a lot more likely, healthcare providers were a lot more likely to really be engaged and address things. And so a lot more information was coming, whereas in Pennsylvania, it was radio silence. And it's continued really honestly to this day. And there's multiple reasons for that. Some of that include some of the providers were actually leaseholders themselves, like they were leasing their own land. Some of it included that the hospitals that they worked with or healthcare systems that they work with really silenced a lot of, I myself got disinvited, from a hospital in Williamsport. And is it Williamsport or Williamsburg? I can't remember. Anyway, Williamsport, yeah, okay, thank you. And then, yes, and then also, often, healthcare providers are part of a community where the jobs or the economic, infrastructure from that community might be relying on a lot of oil and gas operations. Their neighbors might be, and so they might be a lot less, they might be more reluctant to speak to that because of the fact that they don't want to, essentially be an agitator in their community or come across as such. Those are some of the reasons, but I would say that one of the things that always kind of sticks out to me is actually this kind of silencing that happens, the silencing, the mechanisms of silencing that really happens that scares them into, speaking up about it. So, I don't know if you have any.
Okay, thanks. I'd like to move on to some of the questions that you all have asked here. And again, I apologize if I don't get to them all. So this first question is actually from Mary. And I think you can sort of approach this both from how it perhaps was or not, a confounder in your studies, or even broader, how it may represent sort of a additional factor that impacted populations need to think about. And the question has to do with sort of the percentage or the amount of rural versus urban research participants or areas that were in your study. And so given that we're hearing about decreased access to maternal health care in rural environments with hospital closures, decreased obstetric and gynecology care, especially in states where that banned abortion, et cetera. We're talking about cuts to Medicare, which would have severe impacts on rural hospitals more than urban. So, how does that play into your studies in particular, as well as that additional burden to impact the communities? Because that's mostly where these wells are.
Yeah, so this is a really great question. Our study sample skews urban per the census definitions. Now, the census doesn't define rurality very well, so there's a lot of complications here. There's very small towns that are considered an urbanized area. About 7% of our sample is in what the census would declare truly rural. However, when you start building these out into a more broader definition of rurality, it's probably closer to 30%. So there's a decent spread of people here. And I think it's a really good point, right? This is probably more prevalent or more of a problem in rural areas, but the concept of pregnancy planning varies culturally a lot. And so we find that we get more participants from urban areas, even when you consider the proportion of the population that lives in rural areas, that sort of thing. In our analyses, what we do is we just run stratified models. So we check, hey, among our rural participants, does our effect estimate look the same? Among our urban participants, does the effect estimate look the same? In most of our work to date, it's been relatively consistent. So hopefully that answers part of your question there.
Okay, thank you. So the next question is India, and it's sort of a combination of questions, and so I'll touch on the elements that kind of came through. And I think it's basically sort of commenting on the success that you're seeing amongst these different community groups as they organize and attend meetings and et cetera. So has the community citizenship been successful in halting or slowing blue hydrogen build out? What was the result of the meeting that you sort of showed us about? Do you see a correlation between showing up to the hearings and changes into who gets elected in the next elections? Does showing up at a hearing change the outcome? In other words, does leadership change as the result of this citizen mobilization around that?
Hello. Those are all great questions. I can't speak to that last one, though that's a very interesting one. As you know, you may know, we had our governor election just over a year ago. We had a Democratic governor for 2 terms and now back to a Republican one. He's very pro-industry. On the local level, I'm not sure. There's definitely some pressures on, I think there's maybe a tiny bit more success at the local parish council level, where they're really trying to get their council members to listen to them, and to the extent that the parish council has some level of say in what projects get to come to their communities, or zoning types of questions. They haven't been hugely successful, but they keep pushing on that. The hearing, we are still waiting. So that permit hearing happened, the air permit hearing for air projects occurred in October, and we still don't. We suspect they will probably approve it. That being said, to the first question, having that many people show up and so many concerns raised, the agency is required to respond to every concern raised. So the more, and it's not just the same concern, but the multiple concerns. So they might group all the concerns, but in other words, it takes a lot of time to respond to each and every comment. In terms of slowing things down for that I didn't mention it, but I could have, if you kind of remember the map, there's the facility, the long carbon dioxide pipeline, and something like 10 wells that are proposed in that lake. That lake is divided between 3 different parishes, and one of those parishes, there's a rumor that they've asked for the wells to not be located in their parish. And we've been waiting for the wetlands and Army Corps 404 permits for over a year. But because that parish council has asked to move those wells out of their parish line within the lake, we think that's what's taking so long in reconfiguring some of their application material. So we're still waiting. So to the extent that there's success in pushing back, there's like little things like that that are happening that are really, really helpful.
Sounds like the not in my backyard phenomenon.
Yes, but there's also a lot of banding together of communities. It's certainly a dynamic and a tension that we're highly aware of. But people are getting together and understanding that this is happening in other people's backyards, and somewhere, I guess I feel like there's not necessarily something wrong with that, where it's like, I don't want pollution here near my kids and my neighbors. Like, I don't see why that's necessarily wrong.
Okay, thanks. So this next one is for Eric, and there has actually been 2 questions that sort of relate to the sort of technical applicability of using things like drones or other aerial surveillance techniques that might help you identify some of these abandoned wells which aren't in any database, so to speak.
Yeah, that's a great question, and something that's being actively explored and as research goes forward. The thing to know about the drones is that the technology's come a long ways, let me just say that. So like the issue in the past was just being able to mount an analyzer to a drone or find a way to collect a sample But nowadays the technology has gotten so much better that people have now methane sensor drones where they can fly them around and collect measurements. In fact, I've even heard of people using drones to even map out where wells are. You can use some magnetometry surveys to find the wells and map out where the wells are. There isn't a good, there's no, to my knowledge, way to measure the VOCs directly from a drone yet. But what we can do is by building this database of gas composition from the abandoned wells and from other sources, we can then use that, and this is part of what we've been doing as part of our methane and health initiative, is to really understand what are those expected ratios of methane to other VOCs, to know if you see a methane concentration or a plume of this size, you might expect to see, with some degree of certainty, this amount of VOCs. And so that's the real benefit of getting those on-the-ground, boots-on-the-ground measurement of collecting the gas composition from the wells in situ, like we did in the study.
Okay, thanks. So this next one is for Mary, and it's basically two questions, but I sort of say them at the same time because they talk about what might be regional differences or geographical factors. So the first question is, apparently you showed a map. Why would the exposure map indicate that higher exposures in Michigan compared to Pennsylvania, which I guess is sort of, we're kind of used to so many.
Clarify that right away. Are located, and we, by happenstance, have a lot of participants in Michigan. So that was just clarifying that map there.
Okay, so those would be patients, not necessarily where
Exactly, number of people, not number of sites.
Okay. So the next one is there any difference between the Canadian results and the USA results? I assume you had some Canadian people, which might be attributed to different processes of governance.
Yeah, so in our first study on mental health, we didn't see much by Canadian versus US, if I recall correctly. It's a little tricky. Only 15% of our sample is Canadian, so we don't have nearly the statistical power to do as much as we would like. But in upcoming projects, we'll run that as well and see if there's any differences that are meaningfully different in direction and magnitude.
Okay. And another one for Cynthia. And so this relates specifically to sort of what the impacts of blue hydrogen industries would be on local waters. You said that the industry and processing affects local waters. Could you explain that a little bit more? Is it a temperature, chemistry kind of thing? How are the waters impacted with that?
So there's a few things with water. One is the carbon capture technology. For the moment, though this can change rapidly as CCS develops, the most common way of capturing CO2 from the gas stream is to use amine-based solvents. So that's simply water intensive. Louisiana, we have a lot of water, so it's not maybe as problematic as some other areas like California. The amine-based solvents degrade and can contaminate the water where it's being discharged. I don't know too much about temperature. The other concern with water is the CO2 pipeline. So for example, with that Air Products facility that has a 40-mile long pipeline through a swamp that is undergoing massive restoration efforts by the state, by the wildlife management area, by federal dollars, including the Army Corps, to build a protection levee, a flood protection levee, a diversion project to divert more nutrients and sediment and fresh water into the swamp. There are some very kind of highly localized wetland water related issues associated with the CO2 pipeline. And then of course with the injection wells from the facility, you have a big risk of contamination of groundwater sources, and we just don't have enough examples or evidence, or we have a few in like Norway and other parts of the world where they've injected CO2 deep underground and have actually experienced a lot of problems with CO2 plume migrations deep underneath in the reservoir. So those are some of the water issues that we're quite nervous about. And I'll mention another one. There are, even though Louisiana is not known as a place with earthquakes or big seismic events, there are, it's all built on mush, right? The Mississippi River is all, fluffy sediment that's getting deposited and compacts and subsides. So you have these kind of small but many faults along the lower part of the state, and that can still result in a lot of erosion and subsidence in the area. So these are some of the things that we're looking into that are of great concern.
So here's a couple for Eric, and they relate kind of to what might be the sort of local geography or environment that are around these specific abandoned wells. So first off, are there issues with the fact that some of these abandoned wells might be located in low-lying areas that have very little impact with wind to disperse the pollutants, et cetera? Some might be located on top of a hill where where the pollutants disperse relatively easily. And when you mentioned your finding about how many buildings were near these, how many of those buildings were actually residences? And even if it's not the exact number, an approximate.
Yeah, those are great questions. To the first one about the geography near the well, as part of this study, we were only mainly interested in understanding what are the emission rates from the wells. What happens after the well leaks is now a function of meteorology and topography, and at least the meteorology changes from day to day. The topography depends on where the well is. And so the person writing the question is correct to think that, a well in a low-lying basin might have a higher chance for accumulation. There's probably less wind down there. There's more of a way for the gas to accumulate versus something like on top of a hill where it would more easily disperse. But I think that's one of the next steps that we need to do. And I know that trying to this can be done through modeling or other direct measurements. But is to really understand when you see a leak from one of these wells, how does it impact the nearby residences? And that's one of those is a function of the distance of how close it is, but another is what are the local conditions that may allow that gas to be transported and accumulate near the receptors. To the second question about the buildings. Most of the buildings we'd identified were occupied. I don't remember what the percentages were a residence, but they were buildings that were either people live or places of work or schools or hospitals or just occupied, not abandoned or demolished buildings. We did check for those, and there were some, and we adjusted our results based on the verifications component of identifying what the buildings actually were after we did the satellite mapping between the and the local buildings.
Okay, thanks. So this is actually my question that I'm going to ask, and it's basically directed to all of the panel. So you can have your chance to say this. And if we sort of start with the notion that primary prevention is the gold standard of public health practice, referring to measures taken to prevent the exposure from even occurring to begin with. In other words, don't drill wells close to homes or even don't drill wells at all. Obviously, that ship has sailed, or we wouldn't be having this meeting. So then that leaves us with secondary and tertiary preventive measures to manage risk. In other words, find ways to detect health problems early so that they might be mitigated before they have a serious impact, or manage the disease more effectively once it has already been diagnosed. So the question is, so you can't have primary prevention measures. What actions and measures would you propose for people who live close to wells to help minimize any adverse effects of oil and gas development on their health and well-being?
I'll get us started. Yeah. This is definitely not a silver bullet, but silver buckshot situation. Certainly looking at stronger regulations about where it can be done, looking at setback distances, protective buffers, taking into consideration environmental justice communities, legacy pollution, but then also not just where it can be done, but how it's done, looking at stronger pollution controls, better pollution control technology, better monitoring, not just at the site, but where people are being exposed, more open communication between operators and the host communities about what they should expect to be exposed to as a course of regular operations versus what happens during upsets. Certainly more meaningful penalties for violators, making sure that there's sufficient bandwidth for investigations of complaints, as well as stronger regulatory enforcement and penalties that are more than just a slap on the wrist. Clearer communications from public health agencies about what people should expect, what happens if they're exposed, how they can limit their exposure, clearer guidance for physicians about how they can be treating their patients, questions they should be asking, guidance and resources they can be providing, and then certainly broad education to the general public about the impacts of this industry, so that we're not in a primary prevention situation right now, but the more the general public knows about these issues, then they can, in turn, educate their leaders, and if their local leaders do nothing, vote them out in the next election.
Okay. Renee, I'd like to hear what you have to say.
I wanted to say that this issue is not unique to oil and gas. It also has a much broader application to many other phenomena that include extreme weather events in relation to climate change. For example, where can people live when there's a lot of flooding and they can't get flood insurance? The interchange with where there's wildfires and people building where there's a risk of wildfires, and how are people protected from that? And in my mind, I actually feel like this is more of a philosophical issue, in that there is kind of the American ethos is this kind of individualism where we can be where we want to be. And so whether maybe not me, because I'm not a social scientist, or but maybe there could be some sort of a discussion about, can there be a shift in having regulations that really help humans stay safe rather than be in harm's way in context of all of these external factors.
Cool. So I agree with what was said already. The thing I keep going back to is we've been treating this entire industry, or oil and gas development more broadly, as an environmental hazard for the last, 15, 20 years, more or less. And we haven't really made a ton of progress. And maybe it's just that we're conceptualizing it as an environmental hazard when there's other components that might be an easier way to go after this, right? The economic boom and bust cycles that some of these communities are subjected to may be a much more effective way to think about this. And I do wonder if we should be thinking through that angle when we're trying to pull different policy levers. Recently, we've started writing grants on oil and gas development as an economic hazard as opposed to an environmental hazard. Functionally, we're doing basically the same research, but we're just framing it differently. And this economic angle has had basically no pushback. The environmental angle, I get pushback all the time. So just something to think about. I don't necessarily have an answer for all of you, but just consider it.
I've add to what has already been said, but at least from our perspective at PSD Health Energy, our goal is to really do scientific research that's valuable to citizens and policymakers, et cetera. And I think that what was said earlier was really important, is education, is just really knowing, really understanding and knowing what the latest science says, and then making decisions on your life based on that. So one of the things that we know, like for instance, about benzene exposures, that's cumulative. So maybe, well, first of all, just knowing like your personal status, like understanding, like there was that one well I mentioned in the study where there was the renters who didn't even realize they had an abandoned well on their property and it was leaking. So just first of all, just like knowing like your personal exposures to potentially leaking abandoned wells. That's maybe a bit more out of your control to remedy that. But there are things in your life that you can control, which are, you know, your indoor air pollution, for instance, right? We've done a lot of work at PhD looking at the indoor air quality impacts of natural gas appliances, and there's ways that you can help reduce that indoors. You know, like when you cook, if you have a gas stove, maybe try to shift your cooking to more electric appliances, or open your window when you're cooking. And these are all things that will cumulatively help impact your health and as we transition in a world from fossil fuels to more cleaner energy.
Hi, I'm last. I don't know how much more I can add. These were excellent responses. Maybe what I can add is, since I come from Earth Justice, which is a nonprofit law organization, is that the devil is in the details sometimes, and the very boring regulations are the things to pay attention to. I alluded to, you know, those ambient air quality thresholds, and there are some wonky, you know, language and regulations associated with those. One of those boring and super detailed ones is called the significant impact levels, or SILs. It's very weird, but basically it says that even if the air is already above the threshold of the NAAQS, the ambient air standards, a company is still allowed to emit pollution if they just contribute this tiny little bit, because they're not the ones responsible for that overflowing bucket. So I guess using that as an example is maybe pay attention to some of the things that, you know, organizations like so many that are here, APN and Earth Justice and others, who are pushing for these national regulations to change and to improve air quality across the board. Because it's hard to play whack-a-mole for each facility, right? We're going after air products or specific companies, but working on these regulations writ large is a lot easier to attack the problem. But it requires everyone knowing about it and pushing for it as well.
Okay, thanks. I think we're out of time for this particular session. I want to thank our speakers, as well as thank you for your attention and your interest and your questions as well, too. So enjoy the rest of the meeting. I think we're going to have a